everyone. My name is Erin Laird, and I'm the Director of Emerging Infections here at ASTO. State and territorial HAI-AR programs play a critical role in HAI prevention and control. Several significant federal investments have been made for HAI-AR programs during the COVID-19 public health emergency. To meet the requirements of these new investments, HAI programs need support from state and territorial health agency leaders. That's why ASTO made a report highlighting 8 ways health agency leaders can support HAI-AR programs. In this interview, I'm speaking with Brenna Stacy, the HAI-AR Program Coordinator for the Kansas Department of Health and Environment, and the Kansas Health Officer, Dr. Joan Duvey, to talk about 3 of these 8 strategies, specifically how health agency leaders can support workforce recruitment, retention, and resiliency in HAI programs. Brenna, many public health roles evolved during the COVID-19 response as workers adapted to the changing dynamics of the pandemic. How did the roles in your HAI-AR program change during the COVID-19 response?
Well, that is a great question because we had a lot of changes in roles and just a lot of changes in general. So a little background, when I first started in 2017, it was me and 2 epidemiologists, and that was our program. And we were all boots on the ground people. We were all doing ICARs, often in a team, but sometimes even a single person. And so a really big change that came about during the pandemic was, we had even more need to meet as far as response due to all the COVID-19 outbreaks in long-term care and other places really as well. So obviously 3 of us was not going to cut it anymore. And, with all of that increase, we also did get increased funds via the SHARP supplement, which was great. And we were told, increase your team. That's really what this is about. So that is exactly what I did. I got a few more epidemiologists. I brought on, I think about 7 infection preventionists, as well as some contracted infection preventionists. And it's really been amazing because obviously with that increase of people, we've been able to increase the amount of response and helping and going directly out on site and doing ICARs.
And recognizing the growth of your program, are there things that you're doing to support the retention of this new HAI workforce?
Getting that expertise is already hard enough. We're state public health. We're not really super competitive as far as pay. So that's something that I think at least we've all at least tried to justify, and we've tried to put those slightly higher pay rates that we can, especially when we are bringing in people who have like nursing background, IP background, things like that. So that's something that I know I've tried to work on, and I've heard some others say as well. And then something else that I'm trying to work on right now with our HR team here at KDHE is bringing on or implementing a promotional level system for staff in the HAIR team.
Dr. Duvey, the new SHARP funding from the American Rescue Plan Act emphasized the need to build and sustain a strong public health workforce and provided states access to necessary resources for comprehensive HAI-AR programs. How can state and island area health officials support HAI-AR programs with recruitment of a trained workforce?
Yeah, thank you for that question. I think that it's really difficult. It's a difficult question. It's a challenge to find and recruit staff that have an education specifically in the niche area of HAI, AR, and infection prevention. So what we know is that infection prevention there's such a specific role. There's really no formal training opportunity in higher education. A lot of what they do is learned on the job. And because public health salaries really can't compete with clinical salaries, the HAI programs across the country either can't find staff willing to work for what we can pay them, or when we are able to hire staff and get them trained, it isn't unusual for them to leave to work in a hospital for a higher salary. We essentially are training infection preventionists who may move on and go to work somewhere else. But, I guess that isn't all bad. If we think about it, we're training a network of infection preventionist partners who will work with us to support the public health system wherever they might land. We also know that there's a lot of work and demand for HAI staff. And we also have to remember to balance the hiring of more staff to meet the demands of program expansion with the funding that we have so that we can sustain any increase in the level of work that we do. Much of our funding comes from federal programs, and so we have to think about what happens next year or the year after when we may not have the same level of funding and we may not be able to support any program expansions. At KDHE, at the health department, we really do try to compensate for those lower salaries by creating a great work environment, by offering hybrid and fully remote work opportunities, and also by recognizing the great work that staff are doing across the agency. So a couple of ways that we do that is that we value each individual and try to be supportive of their needs. We have great policies for working parents, such as allowing parents to bring their infants to work. We also have lactation rooms to support new moms. And because parents can work from home, they don't need to take sick days if they have to stay home with an ill child. They can be home with that child and do their work from the comfort of their own home. Those hybrid and fully remote positions not only benefit the employee, they also provide opportunities for us at KDHE to tap into talent across the state. People may be located in regions of the state and they may want to stay there. Maybe their families have been there for years. And so we're able to hire them where they are. Having infection preventionists in those far reaches of our state means that they can be hands-on also during ICAR visits at hospitals and nursing homes. We also know that opportunities for advancement are critical for staff retention, and Brenna is doing a great job developing promotional levels for HII program staff, similar to what KDHE has already put in place for our epidemiologists. So that's important because staff can see a path for them to developing leadership and supervisory skills, and hopefully will choose to stay and grow with us here at KDHE. And then finally, one more thing. It's really important to recognize staff for their hard work and their dedication to the citizens of Kansas. And we know that during COVID-19, during the response, our IPs really have given 200%. And we have prioritized formalizing staff recognition and have put into place some programs to make sure that staff know how much we really do appreciate all the hard work that they have done.
Thank you, Dr. Duvey. Another important workforce issue that the pandemic brought to the forefront was the mental health and well-being of our frontline workers. The ceaseless demands of the COVID-19 pandemic response took a tremendous toll on the mental health of the public health workforce. While we continue to see improvements, there's still work to be done to support workforce mental health. Brenna, can you talk about how the Kansas HAI-AR program has supported staff mental health and well-being?
So something I think that I've mentioned before is that it was really beneficial, and something we've always tried to do is send more than one person onto an on-site visit, because it kind of helps relieve that burden of all the pressure just being on one person. It also helps kind of bounce ideas off of each other. So that's something that we've continued to do, and we've only been able to do more of it with the increased team. But something I had to actually implement even more on top of that was to say, each person only does this many certain ICARs a week. Each person has a full week kind of on a rotating schedule, off of travel, off of ICARs, because it really can be a lot, especially having done it before, I know that even just traveling can be a lot. So, I kind of had to implement this for their well-being, because I was worried they were going to burn themselves out.
Thank you for sharing your experience and perspective from the HAI program, Brenna. Those are some really great examples of policies and practices that helped prevent or manage burnout. I would also like to hear from Dr. Duvey on how the health department can support its workforce. What plans does your agency have for supporting the mental health and well-being of your staff moving forward?
It's so important for staff to feel like we are listening to them and supporting them. We have to think about how we support the dimensions of their lives outside of their work at KDHE, not just what they can do for us as employees. And as a mom with 2 young children during my medical residency program, one of my senior residents offered me some grace that I will never forget. Both of my kids were sick, and I was on call in the ICU when she looked at me and said, "You know, I can find someone else to do this, but your kids only have one mother. You need to go home." At KDHE, we really try to value each individual, and we try to be supportive of their needs. I think I mentioned the policies for working parents and the opportunity to work from home if you have a sick child. Also, the hybrid and fully remote positions, they not only benefit the employee and benefit KDHE, but they benefit the whole family. They allow individuals to not have to commute into the office, provide perhaps a little bit extra time in the day for people to cook a meal or get some exercise or pursue um, a, a, an interest outside the home, outside of work, and to have a chance to really nurture themselves. And we hope that this really helps keep our employees happy and healthy. And then, they're ready to give 100% when they come into the office or when they turn on their computer and work from home.
Dr. Duvey, I would love to close out by hearing from you on the most important thing that you have learned about the role and value of the HAI-AR program and how it has helped Kansas in the last couple of years.
Thanks, Erin. I've really thought a lot about that. I think one thing that COVID-19 taught me was how critical the HAI-AR program is to keeping our older Kansans and our healthcare workforce healthy, and especially in our long-term care facilities. Brenna was able to significantly expand the IP program pretty early on during the pandemic, and I know that this expansion saved the lives of Kansans.
Thank you both for sharing your insights and experiences on how HAI programs and state and island area health agencies can build and support the HAI-AR workforce. Continued partnership between HAI programs and health agency leadership is critical to infection prevention, detection, and response efforts. I encourage everyone listening to check out the ASTO report titled 8 Ways Health Department Leaders Can Support Effective HAI-AR Programs for more insight on how health departments can bolster their HAI programs.